Hi, my name is Liying XU. Today I would like to present you a case report published on Journal of Medical Case Reports by Rashidian. Its name is Death of a Neonate with Suspected Coronavirus Disease 2019, born to a mother with coronavirus disease 2019 in Iran. COVID-19 is a respiratory infection. Everyone can be infected if they don't take enough precautions. The question that I would like to discuss today with you is that, is it possible for mothers to transmit the COVID-19 to their fetus in the belly or during delivery? As you might already know, for the pregnant women, due to changes in their bodies and immune systems, they can be badly affected by some respiratory infections, such as COVID-19. Let's focus on this case. The mother was 32 years old. She had a single dry cough when she was pregnant with this baby, and then she gave birth to a healthy baby, but not long after his birth, he started to grunt and had difficulty to breathe. He became blue and started to bleed. The doctors performed a chest X-ray to check out the lungs and found the same signs of COVID-19. Sadly, the baby died. Here are some more details about the baby. Half an hour after his birth, the baby was found with grunting and respiratory distress. He was then given oxygen hood and serum therapy. The initial vital signs were as follows: respiration rate of 67, temperature of 37 degrees Celsius, pulse rate of 128, oxygen saturation of 97%, blood sugar level of 72, and with a clear grunting sound. The newborn was revisited by a neonatal specialist and then transferred to the neonatal intensive care unit. 3 hours later, the newborn was becoming blue. His oxygen saturation had fallen, and he was bleeding even more. 4 hours later, the baby was moaning and had a marked decrease in consciousness level, and his vital signs were as follows: blood pressure of 40/23, pulse rate of 145, respiratory rate of 33, oxygen saturation of 34%, and temperature of 36.5 degrees Celsius. He was blue and had irregular respiration and low oxygen saturation. He was immediately intubated and ventilated, and received 3 doses of intravenous epinephrine, emergency fresh frozen plasma, emergency palliative care, 3 vials of surfactant, 3 mg of vitamin K, and emergency cardiac counseling. Clear nasal and tracheal tube bleeding were reported. The doctors performed a chest X-ray. The appearance of both lungs was quite similar to the signs of COVID-19. 9 hours later, the baby experiences decreased oxygen saturation and bleeding. 11 hours later, a cardiopulmonary resuscitation was performed for 30 minutes due to the fall of his blood saturation. Unfortunately, the baby did not respond positively to any treatment for 6 hours after hospitalization, and he died. So, did the baby get infected by his mother during pregnancy or delivery? We don't know. For now, there is not enough study that can show us the possibilities of mother transmitting COVID to their fetus, and the active virus has not been found in samples of fluid around the baby in the womb or breast milk. To conclude, sadly, we still do not know if a pregnant woman with COVID-19 can pass the virus to her fetus or baby during pregnancy or delivery. Thank you for your attention.